detonation. Hey, look, it's going to be awesome because AI is taking over the world. It's slowly etching in its way into society, and we have an AI expert in the house. It's Dr. Dan Elton. Welcome to the show, Dr. Dan Elton.
Thank you, Steele. Thank you.
It's incredible to have you on because AI, as I mentioned, it's creeping into the world, and it's also creeping into the medical field, right? It's starting to the
Mhm.
robots are taking over finance, and they're going into medicine. You know, how did you get involved with this sort of huge thing called AI in medicine?
Well, first of all, let me say I don't consider myself an expert because I've only been in the field for about 3 years. But I did a PhD in physics, and during that, I picked up a lot of programming skills, and I was doing a simulation of water molecules, and I was studying basically how water absorbs light and some interesting kind of pure science research. But I decided toward the end of the PhD that I didn't want to continue in that field for the rest of my life. And I started getting into machine learning because I'd always had a high, interest in neural networks. And I ended up doing some postdoctoral research at the University of Maryland, where I studied machine learning applied to predicting properties of molecules. And I'm sure most of your listeners know this, but machine learning is a subfield of AI. And More recently, since January, I have worked at the National Institutes of Health, where I've switched fields a little bit, and now I'm looking at applications of AI and deep learning to radiology. In particular, I'm looking at CT scans. And uh, I also have to say that nothing that I say here is represents the view of NIH. I'm speaking as a private individual, but that's where I work right now. And I've It's been very interesting because I've gotten to expose to some of the challenges. There's a lot of hype, but also uh, challenges right now, which I think are going to delay some of the technology a little bit, unfortunately.
Yeah,
Yeah.
and so that's who you are, and also you're a fan of the USTP election. You're involved with that, and you're a Ben Zion supporter, right? Do we have a bit of breaking news on that front?
Yes, yes, I suppose yes. I am uh, going formally endorsing Johannan Ben Zion. Uh, and I have to say it was a difficult decision. Initially, I was actually more of a Haywire supporter, and I have a lot of respect for Rachel Haywire. We can go into that if you'd like. But I decided that as far as the policy and the overall image, uh, I think Johan Ben Zion has better policy and a little bit more attractive image for the looking at the future course of the party.
And so
But yeah, I'm
so
happy to go into that if you would like.
yeah, please do. So
But
why were you initially a supporter of Haywire, and why the switch? Why have you got
yeah,
why have you moved over?
well, well, Rachel Haywire has a lot more uh, bona fides in terms of her transhumanism. Rachel Haywire has been a through and through transhumanist since at least 2010, maybe earlier, and she has been in those intervening 10 years. She's been very active in the transhumanist movement. Um, she's been controversial. She's burned a lot of bridges, but she's been very active. And she set up something called the Extreme Future Fest, which I think was
2011.
uh, yeah. I was gonna say 2012, but yeah. And if you go back and you look at that event, I mean that
Ben
was
Goetzel. Yeah.
that was a pretty impressive event that she did. And uh, now, along the way, she kind of had fallings out with some of the leading scholars like Ben Goertzel and Natasha Vita Moore. But you have to hand it to her that she was a really committed transhumanist and involved in a lot of things. And I saw that I felt like she had the most energy early. She was going on a lot of shows. I think she was the first on your show, and I really like what she's done in terms of bringing new people into the movement. Um, for instance, people from the arts. Right now, transhumanist movement is mostly you have to admit it's mostly male, and it's mostly people that are in STEM or adjacent fields. And I really liked how she's bringing in artists, musicians, and just everyday people, though, which she calls working class transhumanists. So I like that idea and that message. But so, but on the other hand, I think that if she has some baggage in terms of her politics, and she's been a little disorganized in terms of policy. And whereas I think, and also, I think that yeah, just overall very controversial, and the optics. Unfortunately, in politics, it's not really about the truth. It's not really about. I hate to say this, but it's not really about who someone is. It's more about the optics and the perception. And unfortunately, the optics and perception around Rachel Haywire are not good. And I've even heard some people that are very involved say that if she wins, they're going to leave the Transhumanist Party, and they may be time to just start a new party. So I think it would be over if she. It would be it may be a rocky road if she were to win. And so that's why I'm supporting Ben Zion. Initially, I was not supporting Ben Zion because he didn't have a very good stage presence, but he's really worked on that a lot. And he's also done a lot more in terms of getting his graphic design a little better. And I really like what he's doing with the Futurist New Deal podcast, and how he's linking with established transhumanists. He's sort of bringing in the establishment, whereas Haywire seems to be burning bridges with the establishment. So I also thought that the joint ticket of Ben Zion with Kimberly Forsyth was a positive development. Just combining forces. So yeah, so I'm formally endorsing Ben Zion, but if Haywire is to win, I will probably throw my support behind her. So we'll see how it shakes out. But right now, I'm supporting Ben Zion.
All right, that's some big news right there. But yeah, I think we'd all have to either fall in line, or the party might, have a bit of a shake up if Haywire wins. But hopefully everyone would fall in line. So you're a researcher at the National Institute of Health. What do you guys do there? What's the primary function of the National Institute of Health? Is it very diversified? Do you cover a lot of the different diseases, or is it a one-track sort of thing with a generic name?
Well, it's definitely not one track, but they have a very broad mandate to perform research to improve health. And that includes everything from basic science research and to on biological systems. They don't even have to be humans. They could be model organisms like mice and fish and whatnot. But also applied research. So I there's a lot going on. But personally, I can't speak for nearly everything that's going on there. But personally, I work in the clinical center, which is very interesting because it's the world's largest hospital devoted solely to clinical research. So it's actually not open to the public. All of the patients there are there because they have agreed to participate in clinical trials, and that's where and what they do is basically test new medications and therapies in clinical trials. And I work in the radiology department under the supervision of Dr. Ronald Summers, who is a radiologist and a clinician. And he spends a lot of his time in clinical work, but he also has been very involved in researching applications of deep learning and AI to radiology. And he was one of the first to get into that field, and his group has done a lot of groundbreaking work in that. So yeah.
Oh yeah, so that's interesting. So you work in radiology. So let's use that as a segue to talk about radiology. Firstly, for people, can you clarify what is radiology? What does it do? What is it? What does it try to achieve? And then, what are some of the most exciting applications of AI in radiology? So first, what is radiology? And then, what are some exciting applications of AI in radiology?
Well, radiology, as I see it, is imaging the body to diagnose disease. And right now, I am in the work I'm doing. I'm looking at images from CT scanners, but there are many other imaging modalities such as MRI, PET, and ultrasound. And radiology typically involves can involve research with any of those imaging techniques. Now, as far as AI, the idea is essentially to have a computer interpret medical images the way that clinicians do right now. And that's actually been a dream for many, many years. But now with the advent of deep learning, progress has really been a lot quicker. So it used to be that computer algorithms for diagnosis used like handcrafted features that were explicitly programmed in. And but now with deep learning, you basically just have a neural network that's set up, and you show it a lot of examples of, say, healthy patients and patients with disease, and it learns from all that data how to discriminate. And this deep learning has turned out to be a lot more accurate and a lot more robust than the prior feature-based approaches. So that's like kind of a technical overview. Now, as far as where the field is right now, there's actually only one or two systems that have been demonstrated which reach the accuracy of your average trained radiologist. There's one for prostate cancer, and there's there's an algorithm from Stanford that looks at chest X-rays that's almost as accurate as in some regards as clinicians. So it's getting to the point where some of these algorithms for certain diseases are reaching the point where they're as accurate as your average radiologist. But what people don't realize is that radiologists actually span a broad range on their accuracy. So it's probably going to be a while before they reach the accuracy of like a very experienced radiologist with many years of experience. But right now, there's some that are reaching the accuracy of your average radiologist. And this is very exciting because at the same time, there's sort of a shortage of radiologists in the world. And so AI, one of the big roles of AI is going to be filling that gap. Yeah, so
because we see this is interesting because we see AI sort of creeping into different technologies, self-driving cars, facial recognition, and here in the medical field where it can pick up, and sort out these imaging data, where radiologists and cardiologists and whatever else ologists there are, but they miss these sort of things. And so you start to see it seeping in. I mean, if it's reaching the point of where it's averaging, I mean, you can only assume that it's going to surpass at one point. And so the question, I guess, then is will AI replace radiologists? Will there become an inflection point, and then a surpassing where your average radiologist almost becomes an obsolete?
I think it will happen, definitely. But I think the time scale is probably a few decades. I think it's a longer time scale than some of the really techno optimists have predicted. Because I think what's going to happen is that radiologists are going to find a new role for themselves. They're going to start using the AI to assist in making diagnoses, but they're also going to have some input, some human input. And there's a lot of research coming out showing that human AI teams can be better than just human or AI alone. And I think that's what's going to happen. You're going to have the AI and the radiologists teaming together. The radiologist may provide a little more holistic view, and also be able to, I think some diseases are just so complicated, or that the radiologists are going to still have some insights that AI won't have. But yeah.
Cancer, right now, AI is a complement to the doctor in cancer research, for example. So will the doctor will the doctor become a complement to the AI?
Yeah, I think that's what's going to happen. But I have to say that right now, actually, I don't think that AI is being used that much. There's actually sort of a resistance to it, as I understand it. A lot of doctors don't trust it right now, but it's definitely moving in that direction. Yeah.
And even if they don't trust it, do you think that its efficiency it will be legalized, like it will be mandated to?
Well, the FDA is working on how to validate and approve AI systems. It's a little harder than approving conventional medical devices because these AI systems are going to improve over time. So they're going to have to be kind of, like you might get version 1 and then they might push code and an update and you'll get version 1.2. So the FDA is trying to figure out, like, do we have to reapprove every version and stuff like that? But they're working on this very hard. I know there's a lot of interest in the FDA and this, and yeah, I think it's gonna be you're gonna see it going through the clinical approval process. It's gonna take a little longer than people think. Like there's a lot of hype right now, but I do think that in say a decade, we're gonna have AI systems doing diagnosis in most hospitals. Yeah.
Yeah, so I know you're not speaking on behalf of the National Institute of Health, but do you see that
Hmm.
do you see the FDA working with AI researchers and working with doctors on this specific AI? Because I've had body hackers on before, and I've had other people who are a little bit frustrated with the pace of the FDA. Do you see them? Do you see this as a positive area where these two worlds actually meet and there's coordination?
Um, I I can't really speak with a lot of authority on this. I have also been frustrated with the FDA, because as I understand, um, there's there's been a lot of drugs that have had trouble getting through all the clinical trials, which probably could have saved lives. But I have come into contact with some researchers who work at the FDA, um, who are very interested in AI, and that has given me some encouragement that they are working on this. They're at least aware of the what's coming and the issues. And yeah, I hope that it's I hope that the regulation, whatever regulation they settle on, is something that allows it to get approved quickly. Um, but yeah, I can't really speak. I can't really say what's actually going on. It's not really
Yeah,
not
yeah,
really an
yeah,
expert on that.
yeah.
You have to speak to someone who really knows about regulation. But all I can say is I've met um, two researchers who work on AI, and that's given me at the FDA, and that's given me some encouragement that they are they're actually excited about AI.
Cool.
At least those people I talk to, and yeah, with any bureaucracy,
mm.
it's going to be very slow. It's going to be frustrating, but there are people inside. I can say that there are people inside who are excited about the technology. So I view that as a good thing.
Yeah, that you're right. And it doesn't matter in a way that the bureaucracy is slow because the technology is moving so fast that they'll have to
Mm.
react. I mean, there's
Hmm.
these old times of you've got 10 years to approve something because the technology only advances at that speed is out the window. We're talking about monthly, yearly, changes as quick as an update. Because
Mm.
the AI is slowly learning on its own. It's getting better. The code's getting better, quicker, faster. So whether the FDA likes it or not, whether the bureaucracy, the old bureaucratic creaking machine likes it or not, it's going to have to
Hmm.
evolve quicker than it would like to on these issues. And so having positive people inside, like you said, is going to be an asset to them in a huge way. Um,
Hmm.
so Doctor, so let's talk about tell us about your work in deep learning and AI and molecular design.
Yeah, so that was work I did last year at the University of Maryland, and we were funded by the Navy to investigate several different applications of machine learning to designing molecules. And so traditionally, the way, and so we weren't working on drug molecules, but a lot of the research is relevant for drug molecules. And the way that drug molecules have traditionally been designed is you have some chemists that design a molecule that they think might work, um, and then because it's very expensive to synthesize molecules and very challenging, they usually do some quantum simulations or other types of simulations to try to predict using physics whether the molecule is going to bind to certain things in the body, whether it's going to have the properties that you want for a drug molecule, like solubility and not being toxic. And so that's like their traditional way. And the one of the drawbacks of that is that these simulations are very computationally expensive. And so with machine learning, you can predict to fairly good accuracy whether a drug molecule is going to, say, bind to something or exhibit a certain property in just a few seconds, whereas making equivalent prediction with physics-based simulations would take probably days or more on a supercomputer. So it's a lot more efficient way of testing molecules for screening. And then when you find some molecules that are predicted to have the right properties, then you can synthesize those for further testing. So that's the main application. Now, so the first thing we worked on was just predicting properties. So you have a molecule and you just predict properties. And then later, I got into what's called generative modeling, which is where you have a deep learning model that actually generates molecules. Some of the listeners are probably familiar with GANs, generative adversarial networks. And those have been very impressive in terms of generating images. Like you may have seen, like you can generate works of art and other things. And GANs are now being applied to generating molecules. It's a little bit tricky because the molecule is like a three-dimensional configuration, so it's not quite as simple as an image. But you can use the same thing to generate molecules, and I would say GANs are probably one of the most promising approaches. A lot of drug companies are getting interested in that. Also, reinforcement learning is another approach for generating molecules that seems very promising. And yeah. And again, so the idea there is you have this GAN or reinforcement learning agent that generates tons of molecules and that are predicted to be good drug molecules. Basically taking the place of chemists, essentially.
So pharmacology, watch out, I guess.
Yeah, it's another thing where the AI is probably going to be used in conjunction with humans. But yeah, this is coming, and I think I tried to get a job actually working in that field, and the impression I got is a lot of the major companies are skeptical right now. There's sort of like this resistance to change, and but there are some startups. I interview with a number of startups that are working on this stuff, and they're moving very quickly. One of them that may be of interest to transhumanists is called In Silico Medicine, and yeah, they're doing a lot of great work on AI for drug discovery.
And are a lot of these companies coming out of Europe or the United States or China, Asia?
The ones that I've seen are I can think of three or four off the top of my head. Three of them were in the U.S. One of them was in the UK. There's a company in the UK called Benevolent AI, and they're also doing leading edge work on AI for drug design. They have some of the most cited papers. Oh, and also DeepMind. DeepMind is working on this in the UK. So yeah, so mostly Silicon Valley and Cambridge, Massachusetts, and the UK is where I've seen companies, but I would imagine there's probably equivalent stuff going on in China, just as in any other field.
Oh, that's very interesting. So yeah, yeah, that's very interesting. So deep learning, hey? So deep learning is going to, is so okay. Um, so what's happening with the DC transhumanist meetup?
Well, so the DC Transhumanist Meetup was originally founded as the DC Transhumanist Party um, in around late 2015 and early 2016 when Zoltan Istvan was running. And it was very active in 2016 through 2017, but it sort of went off the radar in 2018. So, and this year I have become a co-organizer, and we're trying to kind of reboot it. And we've had a number of meetups, and there are not a lot of transhumanists around Washington D.C. But we're trying to bring people into transhumanism. And so far, I've hosted 3 events. Um, 2 of those were documentary screenings. We watched the documentary Immortality or Bust, which is a great documentary about Zoltan Istvan. Unfortunately, it's not out yet, but it should be out at some point in the next year. And we also watched a short sci-fi film called The Last Generation to Die. And yeah, so we've had 3 events, and we're planning more. Um, trying to see if we can bring people into the transhumanist movement and the transhumanist party.
Very cool.
And also, we're gonna provide support for whoever wins the election, should they decide to come to Washington D.C.
Yeah, yeah, fantastic. Yeah, they need all the support they can get. They're only a small party, and they need to build these connections. With existing infrastructure that exists, and I think Johan Ben Zion is attempting to do that, which is maybe makes him attractive to certain people. So that's good. Is there any other technologies, like, robotics, artificial intelligence, blockchain? Any of these other cool technologies that pique your interest, that you're interested in, that you're looking at. Does quantum computing going to revolutionize the medical industry? 3D printing with organs and all this sort of stuff. I mean, is there any other technologies that are really, really piquing your interest in the medical world and as Dr. Elton?
Hmm. Well, I am excited about technology in general. Um, I wish more people were techno optimists.
Yeah.
As you know, I'm sure you're familiar with Peter Thiel, and he talks about how we're actually living in an era of techno pessimism. And I wish people would sort of become more aware of the possibilities of technology to improve the human condition. So I'm generally excited about everything, but recently, I guess what I've been interested in is I've been developing an interest just the past few months in longevity. Um, uh, I think there's a lot of interesting work going on with printing organs. Um, I know there's a company called United Therapeutics here, which is run right near DC here, which is run by Martine Rothblatt, who's a transhumanist figure, and they are working on 3D printing. Well, right now they're working on lung lung transplants, but they have a longer term research agenda focused on 3D printing lungs, which is pretty amazing. Like, and also growing organs is a neat thing. You can grow you can take stem cells from a human and grow an organ, say in a pig or something like that. And it sounds a little bit grotesque, but actually this is this technology is going to be a huge boon because the organ that is grown will have your genetics, and there won't be any problems with rejection or graft versus host disease. So that's a really exciting area. I'm generally excited about any longevity. I wish we were devoting more. I wish there were more people that were excited about it, but yeah, that's something I've been getting excited about. I'm also So I'm also excited just about just sort of futuristic technologies that like fusion power or cryonics that may be several decades away, but would be very kind of transformational.
Yeah, energy is certainly really important. Cryonics, yeah, it's been going through the motions since I don't know the mid 90s, and they're getting better and better. But yeah, I reckon there's still a ways to go. And Jose Cadero came on this show and he said that there was going to be a cryonics facility here in Australia, which I really want to go see. I think that would be great. Yeah, so it's lots of innovations on the landscape with longevity. Yeah, I mean molecular. This deep learning with molecular design. I mean, if you're talking about pharmacology, there's so many cool drugs that could be created. I mean, molecules. It's just the smallest components of atoms or whatever, like to bond to atoms or whatever. So hopefully you can come up with new drugs and other things that help to enhance humans. Another thing that ties into this, which we've been talking about with Yelashvili, and we're going to have with Kate Lovechuck and others, is the Amazon rainforest, and the fact that the more of that disappears, the less pharmaceuticals and other drugs we can discover anyway naturally in the environment, which is disappointing because there's a lot of hidden potential there. There's a lot of undiscovered, untapped, science and research that's disappearing at the end of a chainsaw. So that's that's disappointing. What about you think about that?
Yeah. Yes. I think that's the main thing we should be concerned about with what's going on with the fires in the Amazon. The concerns about oxygen being production being depleted are actually very misfounded.
Photoplankton.
Most of the oxygen comes from algae in the oceans, and trees do produce a lot of oxygen, but there are also microorganisms and other things in the rainforest which consume oxygen. So the net production of oxygen from the Amazon is very small. But the loss of biodiversity is probably the most concerning thing, and also natural products, what they call natural products, which are molecules produced by plants that may have medicinal value, and that might sound kind of silly to people, like but the truth is it's very hard to synthesize complex molecules. But biology is biological machinery is able to do it much better than synthesis chemists, and so there's a lot of things that actually we don't know how to synthesize in the lab, which can be synthesized by plants. And 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 actually, a lot of drugs that are developed are based on things that occurred naturally. A lot of drugs are started off with a natural product, and then just kind of tweaked it a bit. So like, yeah, that's my understanding. Um, so yeah, that's probably the biggest cause for concern.
Yeah,
Um,
yeah, I totally agree. And remember that, humans, plants, and animals have had millions, hundreds of millions, billions sometimes of years to evolve to the point they are, and they've evolved there for many complicated reasons because of climate and geography and survival context and availability of resources and interaction with the environment. They've done what they've done for a variety of reasons. And humans, okay, humans have sort of learnt to live all over the planet, and they've sort of adapted using this bottom hierarchy of needs. They've built food, water, shelter in wherever they've existed, and we're hijacking evolution, and we're moving beyond evolution through our own consciousness. But the plants and animals and all these, they've sort of come to a natural impasse. And they're ready to be used. They're ready to be discovered. They're sitting there waiting. And they'll take 100 million years to evolve into the next stage.
mm,
Why not capitalize on all that complexity as it exists right now? And that's the disappointing thing about
mhm.
watching it all being felled for, I don't know, for firewood or whatever.
Yeah, I haven't really been following exactly what's going on, but yeah, I agree with you. I agree with what you're saying. And yeah, they're still discovering a lot of new insect species and other plant species because the biodiversity is just so enormous. And yeah, I think people should be concerned. Yeah, yeah.
Yeah.
Although I understand also that these fires are actually fairly common. And actually, there was one image I saw which showed that there's actually more forest fires in African rainforest right now than Brazilian rainforest.
Mm.
But so some fires are just a fact of nature, but I think if you look at the bigger picture, we should be very concerned about the loss of the rainforest and the cutting it down yeah for basically quick profits and
Yeah.
not concerned about the long-term impact. Yeah.
All right. Well, that's about it. So,
Yeah.
is there anything else you want to say
Mm.
on AI in the medical industry? Because it's a very exciting area. It's got researchers, it's got practitioners, it's got a huge consumer base, I guess, it's out there.
Mm.
We've got regulations in the mix.
Well, I think it's a very exciting area. And uh, I just I think we need to be a little patient because unfortunately because doctors are going to be slow to adopt these systems. But maybe next time you see a doctor, you can ask them like, are you interested? Are you using AI? I th I think we need to uh, we as consumers need to advocate for it. I think there's the resistance among doctors, and also if you look at just the infrastructure in hospitals, it's really not set up for AI. Just the way they do things is kind of old fashioned. Like they record, like handwritten dictate. They record like dictations and the way they process the images is not very centralized, so the images are all over the place. But once we fix some of these issues, it's going to be a very exciting future.
Yeah, yeah.
Yeah. But I just want to say I do. Yeah. My experience so far is let me believe it's a little further off than we might think, but it's going to be very exciting. Yeah.
Yeah, and this is a really good point, because any countries that are listening that are new on
Mm,
the scale, they should be building for the 21st century innovations now. It becomes hard with I was talking to Victoria Yustemenkov on this idea, and it becomes harder with established developed countries, because they accidentally, not on through contract law and other things, they lock in older products for a long period of time. They say we need X
mm,
machine, and they lock it in for a 20-year. It's obsolete in 3, but they didn't see that way back when. So, and
mm,
they lock in processes for 5 or 10 year periods of time, and
mm.
those processes are obsolete within a year or two, and they're stuck with under a certain regime and waiting for different managers, waiting for different funding regimes. So you end up with hospitals that are at different development stages all over the place, and it makes it very unorganized and unfriendly for quick changing development processes.
Yeah, yeah. And I guess the one other thing I would say is I think we need more people in the field, and that's one of the reasons I support the Transhumanist Party and having transhumanist policies proposals to address the shortage of talent by having better education and more investment in science and technology.
The o- the o- the
Yeah,
the o-
yeah.
the other interesting thing is that as these technologies advance and the price point drops, the adoption for poorer countries will become more common, right?
Hmm.
Because the price
Right.
point will drop, the complexity will increase. So, in that way, do you see that as a positive thing, that these will proliferate across the developed and undeveloped worlds a lot quicker, just like a lot of the other
Hmm.
technologies have? Do you see
Oh
that
yeah,
happening?
yeah. Yeah, in fact, I think a lot of the systems are actually going to be applied in the developing world first.
Mm.
So, like where there's a shortage of radiologists. So, like for instance, in Africa, they have a lot of they don't have CT scanners much there, but they have a lot of. I've heard they have a lot of chest X-ray machines, but they don't have trained clinicians. So there's a huge demand for having software AI that can read chest X-rays, and yeah, that's going to be one of the first big use cases. Isn't and then of course if what you can do is you can use it for screening also. If the AI says there's a high probability of certain disease, then you can send it to a professional radiologist and they can look at it. But it can reduce workload in that regard. And yeah, that's it. I think the developing world is where it's going to be applied first, just like you see blockchain being applied in the developing world um, because of the lack of traditional banking, and then it will sort of percolate through. Yeah.
Yeah, yeah, totally
So
agree.
yeah,
So
it's hmm
you also got a website, www.moreisdifferent.com. So if people
hmm
want to read more about you, what's up with that website? Is it your pet project?
I have some blog posts on there I've written. I haven't been real active writing recently, but I have some blog posts. I have one on Moore's law, which people might transhumanists might find interesting. And then also I'm on Twitter at More is Different. Um, so yeah, if people want to follow me, um, I may be doing some interviews soon with some different transhumanists. So I encourage people to look out for that.
All right, cool. All
Yeah.
right. Well, thank you so much for coming on Detonation. It's absolutely
Hmm.
fantastic. And
Yeah,
yeah,
it's been a real pleasure. And I also just wanted to say I really appreciate the work you're doing, um, uh, furthering the cause of the Transhumanist Party and the candidates that are running.
oh,
So
thank
it's
you.
just been it's been a great service you've provided to the Transhumanist Party.
Yeah, no, thank you so much. Yeah, that's encouraging, and we're learning a lot. We're all learning a lot, and it's a lot of
Hmm.
fun. So thank you very much for your encouragement. It helps me a lot.
Yeah.
Yeah, but thank you coming on the show. It makes it, it's all part of the people coming on and having a good conversation. So, so thank you so much, Dr. Elton, for coming on and talking about, the advances in radiology and AI, and how these systems are, enhancing human life, human well-being, human happiness, and pushing humanity to take it to the next step. So thank you so much.
Yeah. Thank you.
All right, Detonation, all more coming to you all this way, all this week.